good. All right, so welcome back to another video. My name is Hosam and I'm a second-year medical student at the International Medical School at the University of Bari, Italy. And already back in May, we had the beautiful opportunity of going to the neurosurgery department to film the different kind of clinical aspects that you get to do as an upper year medical student, organized together with, well, she's now a 6-year medical student, Alessia, but back then I was a first year and she was a 5th-year medical student. So we had the beautiful opportunity of going to the ward and film different aspects of it, and hopefully it'll help bring a view of what you might get to do as an upper year medical student at the International Medical School here in Bari. So just before showcasing the whole video, I'd like to make 2 important points. And the first one is that this video will contain sensitive images, so be advised about that, be warned about that. And the second point is that we did ask for the permission to go into the wards, the department and film, and got the permission signed by the director of the neurosurgery department, Professor Signorelli. Yes, without further ado, let's take a look at the day at the neurosurgery department.
There you go. So it's a beautiful day in Bari. And today we'll be following Alessia again in her 5th year, the 5th year student. And she's doing her thesis now in this building right here, which is the Asclepios building, the neurosurgery department. So she's invited us to follow her in the ward and get a view on what later year students in the BEMS course usually do as they start their clinical practice. So just texted her, we'll be waiting for her and she'll show up hopefully pretty soon, and we can get started with following her around as a medical student in the ward and see what kind of clinical practice you can do in your later years of the medical school here in Bari. So yeah, let's wait for her and hope that she turns up pretty soon. You're all the way back there? Hello, beautiful. How are you? Good to see you.
Okay, you're already dressed. Did you find
too.
it in Oletta?
Yeah, so
Great.
Rita, she helped me.
Okay,
What a great girl.
great.
So we're here with Alessia again, and we have the privilege of joining you with your thesis and a day at the neurosurgery department, right?
Yes.
So could we talk first a little bit about the thesis? How does it work here in Italy?
Okay, so in medical school, in order to graduate, you need a thesis, and you can actually, you are free to choose where to do the thesis and which professor. Of course, it's something reciprocal, so also the professor needs to accept you.
Okay.
Because sometimes there are many students, and so he says, I am with too much works. I asked to Professor Signorelli to do the thesis with him in neurosurgery department because I really love the neurosurgery topic, and I also like him a lot as a professor. He's very, very good, and he teaches in our course neuroanatomy at the 2nd year and neurosurgery in the 5th year.
Okay, yeah.
So he's a professor that kind of knows us because he follows us during our journey in the medical school. That is actually very nice. And
he's also a neurosurgeon,
and
right?
he's also a
Yeah,
neurosurgeon.
he's a neurosurgeon.
Yes.
He teaches and he's a neurosurgeon at the same time, right? When you say thesis in this case, is it just going around in the apartment, or is it actually like a paperwork thesis
of course
you're doing?
it's like a paper. Normally in Bari, but I think also somewhere else, it works that you first follow the activities that they do in the normal department, and then after some months they give you material and give you a topic. So for example, my topic will be glioblastomas in this type of patients
you're handed it. Can you choose for yourself what you want? Or?
With Professor Signorelli, he proposes us multiple topics, and you can choose. I still haven't decided mine, of course. So what I'm doing now, here we do, it's like that you go, you practice a little bit, and then close to the graduation date, so some months before, you go to the professor and you choose with him a topic, and then you have, of course, to
write about it.
Write about it.
Defend it.
Defend
it. Argue for it. Yeah. Okay. What is it in your department or your department, the department that you're doing your thesis in? What is it that you usually do now as a 5th or 6th year or upper year medical student? So, like the different tasks that you're doing. So what are they usually?
Usually we help a lot the work of the specializzandi. And so
that's a specializing, those that are specializing in there.
Yeah, so the doctors already that finished and entered in this school.
Yeah.
And we help them a lot because they have a lot of things to do. And so we can learn a lot by them because they are students as us still.
Yeah.
And so they can teach us a lot and we can help them back. So they also need us in a good sense because we can be, if we are learning well from them, we can also be very helpful for them in order to help them in what they're doing.
Take off some of their weight.
Yes, exactly. I didn't have I wanted to say it in Italian. So.
How do you say it in Italian?
Non mi viene più. Vabbè. Alleggerirli.
Yeah, I didn't understand that, but one more time.
Alleggerirli. Alleggerirli dal loro carico di lavoro.
Nice. What she said. Now,
and by doing so, normally here we go on Tuesday. Like the best days to go are Tuesday and Thursday because you can do the pre-recovery. So what we did, what we are going to do today, and so you interview the patient that will need to be operated soon, and you make them the anamnesis, you make them the anamnesis, the past history, and you ask them what is their treatment, if they're undergoing treatments nowadays, and what is their diagnosis and why they will need to be operated.
So it has been confirmed that these patients are going to operate, they're going to have surgery.
Yes.
How many days, weeks, or months before is this consultation that we might see today?
It depends. Like it can be 1 week, few days, or even 1 month. It depends on the severity of the case.
Ah, right. I see. Yeah. So hopefully we'll get to see some patients that you're going to visit.
Okay, Alessia, could you just tell what's going on behind this door right here?
We are interviewing a patient that will need to be operated in few time. And so we are taking the history of the patient, the anamnesis. We are again making exams to see whether something changed or not. And then the patient will be prepared, and then we'll have other exams, for example, like blood exams, other type of exam, and then it will be operated in a week, in a few days. It depends, of course, on the case.
Yeah, so now we have behind this door a patient being consulted with about the operation that is about to happen. So hopefully we'll have the consent, but otherwise we'll see how this goes, right? Okay.
Quindi è detto che ha fatto un intervento di ernia inguinale, non ha avuto Covid, ha ipertensione, ha fatto altri interventi in passato per caso? No. Niente. Quindi c'è... Va bene?
Digitalizzazione dei denti.
Revitalizzazione per le case.
Perché adesso devo mettere un ponte ancora, che lo stavo curando, quando è successo fatto ho bloccato tutto.
Quanti denti ha digitalizzato?
2.
Quali? Molari?
Molare, dietro e uno davanti.
Ha fatto l'ECG, vero? Il prelievo? Sì.
Olfatto, ottico, oculomotore. però non mi ricordo come si chiama. Vabbè. Ha problemi di olfatto, sente gli odori bene?
Sì.
Ok. Cioè, non è proprio facile mettere questi guanti. Ok.
Ha fatto per caso una visita cardiologica?
Sì. Sì, ecco perché sto prendendo il piso del...
E ha portato magari la carta di questa visita? Un attestato della visita? Un qualcosa che le hanno rilasciato?
No.
No, noi mi sono arrivato questo prima pure io, se non sbaglio. Ha detto che non trova niente.
Sì, perché ho fatto una visita cardiologica dove c'era la pressione alta e sto prendendo le...
Va bene.
Può seguire con l'occhio. Ok. Mi dice se sente uguali da entrambe le parti? Tutto bene?
È uguale sia a destra che a sinistra?
Della forza. Sì. Giù manca, no? Era da un lato e dall'altro le mani anche. Vabbè. Si può rimettere gli occhiali? Stenda le braccia. Perfetto. Mi dica se la sensibilità è uguale da entrambi i lati. Uguale. Può stringere le mani? Forte, più forte. Ok. Adesso alzi le braccia così.
Palmi
Perfetto.
verso l'alto.
Palmi verso l'alto.
Il palmo verso il muro. No, al contrario.
Ok.
Così, bravissimo. Chiudi gli occhi, mantieni così. Bravissimo.
Perfetto.
La sensibilità è vista?
Sì, ho fatto stringere.
No, la sensibilità.
Sì, sì, sì.
Where are we now? What is this ward that we're in right now?
We are in some corridors of the neurosurgery department, actually. And this is where I normally came here in the morning around 8. And before going to the briefing, so where they do, let's say, a sum up of all the patients they have here. I just go here, where it's written medico di guardia, in this room, and I change myself.
And you need the scrubs, and you need the...
like this.
Like this.
It's like
Exactly. So this is where you change. And usually when you... How does that work with lessons and everything? So it's just the changing room showing around a little bit, but...
Okay, so I'm missing lessons actually to come here. Because normally the thesis starts at the 6th year, but I starting it early just because I would like to graduate earlier if I can. If I can. And so when I have time, I come here. It's not like mandatory, like you can come here whenever you want. There's no like mandatory on Monday and Tuesday. Maybe in other departments it's like this. Instead here the professor wants us to come when we have time so that we can, have an equilibrium between studying, lessons, our free time, and when we are free to come here and learn, we come.
So is it an arrangement you make with the professor?
Yeah,
in this case, Signorelli, you say,
in this
hey,
case, he wants us to come whenever we are free, like whenever we have time to come here, concentrate and learn. I think this is the best thing because sometimes you have to study for exams, and so maybe you don't have time to come. And if you come here, you do it like very fast without actually.
It's very flexible. It sounds like. How does one do that? How does one if you want to do something in a certain department, you just contact the professor?
Yes,
And
it's
then
like this.
usually they're open for
Yes.
you walking.
Normally, yes. It's
Yeah.
like this.
Exactly. Perfect. So what are we going to do now? What do you think? What do you feel
I
like?
think I will bring you to the operating room. I don't know what is happening, so we'll discover together, actually.
Let's hope so. All right, let's go.
Let's just go before to the stanza medici to see if there is the specializzanda we were together before.
Yeah, I don't know what that is, where we're going, but you said something in Italian, but let's go.
Eccoci. Possiamo andare in sala?
Vi accompagno.
Vai.
Ciao.
Cosa avete fatto fino adesso? Cosa avete fatto?
Se viene la paganetti per i così poveri, mi avvisi, va bene. Vi accompagno.
Sembra di essere tipo in un film, capito?
Ma stai girando avanti adesso?
Penso di sì, non lo so. Io sto camminando. You're filming, right?
Yeah. No, but you, but it doesn't.
Here we dress. Also, you have to
dress.
dress too.
Okay, could we talk a little bit about what is it that we're gonna? Thank you. What is it that we're gonna see?
Cosa andiamo a vedere?
Craniofaringioma in a small patient of 5 years old.
Oh, 5-year-old patients. That's going some.
Ma il craniofaringioma, dove si localizza?
Sovrasellare. La sella tuscica. Questo è proprio sopra la sella tuscica. Infatti molto spesso si può fare per via endonasale, solo che questo non è nella sella, ti trovi tutta l'ipofisi davanti e la sella sopra, perciò hanno preferito fargli l'approccio tipo un orbito zigomatico.
Orbito zigomatico. Ok.
Could we have that translation in English?
Sì, sì, sì. Put the mask before.
Yeah, could you hold it for me?
Ti filmo.
It's all good. It's all good.
Yes, we are going to see a craniofaringioma that is close to the pituitary gland. È la pituitary, vero? In a baby of 5 years of age. And it's a very long intervention. I think it will last till this evening.
I think maybe until the 6-7 years p.m.
6-7 days?
No, 6 p.m.
6 p.m. Oh, okay, 6 p.m. Good to know.
Days no.
And how far have they come in the operation? How far have they? How far are they in the
Appunto
operation?
sono.
I
Dietrissimo
think
sta.
that they are. Credo che hanno fatto la craniotomia.
Cranectomia. I think they are at the very beginning.
Craniotomy, and now the professor will start with the removal of the tumor.
Okay.
Chiudiamo tutte le porte. Close the door when you end.
Guess this is a big door.
at the very beginning, and they are still doing the craniectomy, so opening the school. I don't know where they're now. They're opening the school in order to enter later on and operate the craniopharyngioma, which I said to you is a tumor very deeply located close to the sella turcica. And so it's a very long process because at the beginning the patient came here at 8 around, was under anesthesia, then they had to prepare the whole room, put dresses on the patient, and then they start to do the craniectomy. Since it is a baby, it's a very long process because it's very, delicate condition. And within 1 hour, 1 hour and a half probably, the craniectomy will be ended. The professor that is going to operate the patient you will imagine him seated on a chair, specific neurosurgery chair, and will see inside the brain, looking for the tumor with specific microscope, and we will be able to see the whole operation via the screen. So now you don't see anything, but then when they open, you see everything because we see what we are seeing via the microscope.
And can we show here? So we can see that.
So this is used for the navigation. Normally, it has already been done. When the patient is positioned, there is a sort of pen like this, that is put in the cranium of the patient, and it is used to sort of scan the patient and to know exactly. And thanks to this, when the professor is operating, we know where we are.
Yeah.
So there is a sort of sensor on, for example, the thing that the professor is using to remove the tumor, which shows you in real time where we are. So,
and this machine, is it somewhere around here? Can we see it?
It's this and this thing.
Okay. So now they're just at the stage of opening up the cranium, and then.
But when they are operating and they are in, like here, the professor knows he is in that specific point thanks to the navigator that they did before the surgery started in order to sort of fix the position of the patient. And so when the professor enters, we know where we are.
Okay.
At specific millimeters, of course, not generally.
So to be very precise.
Very precise.
Very precise, yeah.
So they're putting the stitches and they're preparing the passage for when the operation will start.
Yeah.
So they're opening the passage. Then, after they finish this, there will be like a sort of break in which they will reposition back the patient, and the professor will sit on a specific neurosurgery chair and will enter with the specific tools he uses.
Okay. And
and
it's
remove
not,
the
it's
tumor.
not this, it's other tools that they use.
No, this is the microscope in the back.
Okay.
And uses, I don't know, forceps, I don't know what they are called neither in Italian, in order to enter, pass through the vessels, through the brain, and remove the tumor in the position.
Yeah.
And it's a very long process also, because you have to be very careful, attentive. You cannot make wrong moves.
Well, what are your feelings standing here? What are you thinking as a fifth-year student? You know, what goes through your mind as you're standing in the operating room?
I feel that I want to learn to be there. To be,
You want to be over there one day.
yeah, I would be. I don't know if in a surgery or another place, but I would be want to be there operating.
Yeah, yeah, it intrigues you. Yeah.